Good afternoon and welcome to this Institute for Government event on Arts and Humanities research in the COVID-19 pandemic. I'm Dr. Alice Lilly, Senior Researcher at the Institute for Government, and we're delighted to be bringing you this event this afternoon with the support of the Arts and Humanities Research Council. At the IFG, we've long been interested in how researchers and policymakers can engage each other to understand and improve public policy. And there are perhaps few public policy challenges that are as immediate or as vast in scope as the COVID pandemic. For many of us in the UK, this week marks a year since life began to noticeably change as COVID took hold. The pandemic is, of course, first and foremost a health crisis, and science has taken a leading role in treating and fighting the virus. But the pandemic has also had profound economic, social and cultural consequences. It's affected almost every aspect of our day-to-day lives, from how and where we work and learn, to how we balance professional and family life, to how we consume, what we do with our leisure time, and even how we communicate with each other. So the arts and humanities are at the forefront of efforts to understand the longer-term social, cultural and economic consequences of the pandemic, as well as helping to shape a range of immediate policy responses. How can researchers in the arts and humanities best engage policymakers and shape policy debates? How can they ensure that the research they do generates change? And what has the pandemic meant for how researchers go about their work? To discuss these issues, I'm delighted to be joined by four academics from across the arts and humanities, whose research speaks to a range of the pandemic's consequences. Dr. Rebecca Brown is a postdoctoral research fellow at Oxford University's Hero Centre for Practical Ethics. Dr. Sabrina Jaman is Senior Lecturer in Law at City Law School, as well as a member of City University's Centre for Healthcare Innovation Research. Dr. Frances Hollis is Emeritus Reader in Architecture at London Metropolitan University. And we're also joined by Dr. Adam Baer, Senior Lecturer in Contemporary and Popular Music at Newcastle University. Thank you all for joining us. Now, before I turn to our panellists, just a couple of quick housekeeping points. First, do be aware that this event is being live streamed and recorded, and we're also live tweeting this event. If you'd like to join us by tweeting along, please do feel free using the hashtag IFGHumanities. And second, if you've got any questions for our panel, we're really keen to hear them. So please do post them in the Q&A bit on the side of your screen, where we'll be keeping an eye on them. We'll try and get through as many as we can, so you can start posting your questions now and keep on going. And if you see a question already posted that you think is particularly interesting, do use the like function, which will bump it up our list and means we're a bit more likely to get to it. And if you are asking a question, please do let us know your name and where you're joining us from today. So without further ado, I'm going to turn to each of our panellists, who are going to speak for about 5 minutes or so about their areas of research and expertise, and offer some initial reflections on how they've adapted their research and impact work in light of the COVID pandemic, and how they've tried to influence debates over policy as well as policymakers. So first, Rebecca, over to you.
Thanks very much, Alice. It's great to be here. It's really nice to be invited. A part of me feels like I should be in the audience for this, really, rather than sitting on the panel. I'd be fascinated to hear how we should go about influencing policy and being useful at times like these. But anyway, I'll discuss a little bit of my work and what I've done recently. So I am a philosopher, and I mostly work on public health ethics issues, and over the last few years, this is really focused around questions of responsibility and how we think about whether or not people are responsible for behaviours that affect their health in various ways. So my focus has been on chronic disease rather than the current focus with the pandemic of infectious disease. So I'm mostly interested in chronic diseases like cancer and various forms of heart disease and lung disease. But when the lockdown happened and when we all started thinking very seriously about COVID-19 and what this means for us and what it means for policy in the UK, what countries should be doing, it became clear that perhaps I should think a bit less about technical questions of responsibility for habitual behaviours and consider what my kind of public health ethics work could contribute to something like the discussion about the ethics of policy responses to COVID. And a couple of my colleagues at the time, so this is quite early on in the lockdown, so kind of April time, I think, a couple of my colleagues had started getting questions about immunity passports, and one of them had appeared on Al Jazeera on a news piece where they were being asked to comment on immunity passports, and we thought it would be quite useful to have a bit more of a think about this and see if we could write something sensible about the prospect of documenting when people had been infected with COVID-19 and subsequently recovered and were then presumed, perhaps, hopefully, to be immune, and whether they should still have to observe all the kind of social distancing and restrictive lockdown measures that the rest of us were having to stick to. So that's what I spent most of last summer doing, really, was kind of thinking and writing a bit about immunity passports and focusing on the kind of ethical issues here. And it was mostly questions about, so to begin with, actually, lots of the concern was really about, they were empirical questions, right? So do we know that people are immune? How robust is immunity? How long lasting is it? To what extent does it prevent transmission? Those kinds of things. And so that those sound like the kind of things that an immunologist should really be dealing with, as opposed to a philosopher and ethicist. But some of the things that we need to think about are just how certain do we need to be about those kinds of questions before we kind of restore people's freedom. So how confident do we need to be that someone will be immune for at least 6 months or at least a year before we start introducing something like an immunity passport? So there are ways in which ethics and philosophy can contribute to those kinds of debates, like how we interpret the empirical evidence, how important it is to have certainty. This whole time, the World Health Organization was saying we have no evidence of immunity to COVID-19, which seemed like a really unhelpful thing to be saying. It just wasn't true. You can't know if immunity to COVID-19 will last for 10 years until you've waited 10 years after people have encountered the infection. But that doesn't mean that we can't have a reasonable guess about how persistent immunity is likely to be and how protective. So those kinds of questions I felt we could contribute a bit to. And then there were other kinds of questions around fairness and discrimination, concerns about privacy, these kinds of things that were more squarely kind of ethical questions. So this was really what me and my colleagues were working on. In terms of kind of how we sought to engage with or influence policymakers, I have done more media-related activity with these kinds of questions than with any work I'd previously done. And I played a reasonably passive role in this. I mean, we published 2 papers, one in a medical ethics journal and one in Lancet Infectious Diseases. And no one paid that much attention until the first vaccine was delivered in the UK. And at that point, immunity passports turned into vaccine passports. And suddenly there was quite a lot of interest around whether people who'd been vaccinated should still be subject to kind of lockdown measures and these kinds of things, and how this was going to shift over time as more and more people became vaccinated. And so since kind of early December, there's been quite a lot of discussion in the press. We've done various kind of radio, TV interviews for kind of written articles and those kinds of things. And it's what I found difficult but important here is to try and maintain a degree of kind of intellectual honesty around my feelings about immunity passports and where I think the arguments lead us. So it's easy because I'm cards on the table. I think that there's strong ethical reasons for introducing some kind of immunity passport. I think the arguments for for not allowing them to be used are fairly weak, and particularly the ethical arguments. But that could change. You know, other contextual factors are important to that kind of a position. And it's quite easy to get pushed into a position where you're strongly advocating a particular policy. And I don't want to do that, because I think there are lots of things that I might not know about that could make immunity passports a bad idea. But if you're given 2 minutes on Radio 5 Live and 3 questions, then it's quite easy to kind of make the mistake of just straightforwardly advocating a policy, come what may, and particularly when the arguments against them are being presented in very poor and uncharitable ways, I think. So I've done quite a bit of media, and we've also just recently, led by a colleague of mine, actually submitted evidence and our thoughts to Michael Gove's review of immunity passports or vaccine passports. So I don't know how useful they'll find it, but we've kind of, to some extent, done our bit there to try and present the arguments as we see them. I don't know how long I've been talking for, Alice.
Great,
but,
no, that is perfect.
Good, okay.
That's a really good starting point. So thank you very much for that. And I suppose then, sticking with some of the more kind of ethical and moral questions that have been raised by a lot of the medical and scientific aspects of COVID, Sabrina, it'd be great if you could go next.
Thank you very much, Alice, and the Institute for Government and AHRC for inviting me. It's really a pleasure to be here, and following Rebecca's great contribution as well. I'm going to talk on the same theme of the impact of the pandemic on my research as an early career researcher in law. For me, the story is slightly different, because everything started kind of in April 2020, and the reason was that I was still on maternity leave, and that was the last week of my maternity leave, and I got a gentle nudge from a senior colleague at City that said, oh, there's a call for papers out from one of a peer-reviewed journal that we publish. And I said, really, what am I going to be talking about? That I have a child that I'm homeschooling, that my hands are cracked with hand gel because I'm a paranoid public health lawyer. I don't know what to talk about. And she said, no, just fall back on what you know. And I know a little bit about ideas of justice, NHS reforms, because I had just published in March 2019 my monograph on healthcare reform and these ideas of justice. So I thought, how about looking at whether or not COVID-19 will be kind of a unprecedented, eventually was, and whether or not it will affect the egalitarian kind of approach of the NHS. So that was the first piece of peer review publication, and to my great surprise, as an early career researcher, it was published very quickly. And then I decided, well, this is great. Let's apply for funding. Let's do all those things that I've haven't done so far, and we went with my co-investigator to apply to fund for 2 applications. Unfortunately, not successful, but we got the idea far enough to be elaborated that we're still taking on the project and got secure internal funding for it, and that allowed me to get some networking with people outside of my field in organizational studies. And there's the political context around the pandemic that played a big role as well in my research, particularly the Black Lives Matter movement, that highlighted some areas of my research that I wanted to showcase and I didn't have the chance to, so I focused more on gender and race issues with my co-author at City, Adrian Young, and we went on to write a piece on ethnic minority and migrant women and their access to healthcare, and whether or not the pandemic has heightened these barriers. And we were really shocked again to see the piece published within a month or so, and to see it score among the top 5 most downloaded articles of that journal. So that was a great surprise. So when we had these peer-reviewed articles, or I did in hands, I decided to go to further in the dissemination and try to create impact, as I was taught by the AHRC and Institute for Government workshop. So usual suspects, the conversation. UK is a great place to start writing a blog post on COVID and the NHS, and another one on ethnic minority and migrant women with my co-author. And then I was approached by an academic blog that wanted me to write about my own monograph that was published in 2019 that went a little bit unnoticed when it was published. And then all of a sudden I was a very hot topic for healthcare, because I was talking a lot about resource allocation and rationing. So at that point, the mainstream media started getting interest, and that was time where I needed to change the sweatpants for kind of the blazer and get on TV for my first TV appearances. So I was approached by a Turkish channel that's the equivalent of Euronews, and they were very much interested about healthcare workers and their treatment and healthcare rationing and triage. And then the written press approached me, the Times and then Al Jazeera English were interested to offer comment, and even German newspaper Freitag was interested in that. So that was really nice and very impactful and very quick, but also there were downsides to the pandemic. Let's be honest, it's a very disruptive event for all of us. And as I was mentioning before we even started the event, I have 2 young children. So that meant that we have had periods of self-isolation because of different people at school having COVID, plus the homeschooling, this previous lockdown that have greatly impacted my workload and the way I work. I don't think I've worked so late at nights ever since I left the private practice of law. Also, a very big downside was the third peak of infection. Of course, needless to say, it's downside for everybody, but it coincided with the beginning of my sabbatical, which meant that my research project on the impact of medical professionals in the guidance of emergency guidance for COVID-19 could not start and has been on pause ever since because they were simply too busy to answer questions as participants in my study. They were fighting on the front lines. So understandably, they could not do that. But there's light at the end of the tunnel. I would say that the experience that I have acquired in a very short time span, I have been able to transfer in a multitude of projects that are more or less related to the pandemic. And I see, of course, that the frontline workers now are less busy and more available. And I see their willingness also to work with us to try to create impact within the profession. So my impact would not be necessarily at the governmental level or the policy making just yet, but this is very clearly more at the organizational level, an impact on the Royal Colleges and the way they deliver or draft their guidance and try to make them more consistent and fair, reflecting my research on justice. So I think I'll stop right there. I'm happy to answer questions.
Thank you. Thanks so much, Sabrina. And I'm sure there's a lot we'll want to pick up there a bit later, particularly as well about some of the just very practical kind of logistical challenges that you mentioned to anybody trying to do research or impact work over the last year. On which note, I think it'd be really helpful to turn to Frances, who's thinking about something that I think is affecting all of us in this event right now, which is how we balance our professional and sort of work and home lives. Frances.
Thank you, Alice. Yes, so great to be here. A really interesting conversation already. And my research is in a different field. I started 20 years ago by getting fascinated by buildings that combine dwelling and workplace. And over the last 20 years, I've developed a field of research that I called the architecture of home-based work. And so I started by my doctoral research. I've done dozens of case studies. I've written the history of this building that combines dwelling and workplace from medieval times to the present day in England, and then done a big spatial analysis and developed a whole series of spatial typologies, published a book, got a big knowledge transfer fellowship from the AHRC, and then a lot of interest in the Netherlands. But really, in the UK, it was like, this is too difficult to do. And so the research was sort of running into the ground. And I was thinking, well, this will probably be really useful in about 20 years' time when we all have to work from home because of climate change. And it never crossed my mind that something like COVID would happen. And then, of course, a year ago, suddenly we're all working from home, and the fact that I've done this research into the architecture and urbanism of home-based work suddenly became incredibly relevant. And so this has been a very, very busy year for me. To start with, I had no idea what to do. It's like, I've got this body of research. How do I get it out there? And so I started by sending just a tweet a day that said, brilliant building designed for home-based work #1. And I got to number 43 before my workload overwhelmed me. And I suppose it falls into 4 areas, what I've been doing. Collaboration. I've built up really interesting collaborations with a whole range of different people, including a little startup, the Work Home Project, which is investigating and promoting good design for home-based work. Influencing, I've submitted evidence to 3 APPGs, the Welsh mandatory quality standards for new homes consultation, because basically something I wouldn't have dared say a year ago is that our homes need to be bigger. In the UK, we build the smallest new homes in Europe, and actually we need more space if we're going to work from home. I've submitted evidence also into the Housing and Social Mobility APPG's inquiry into housing and employment, because in many ways the people who've really suffered are the young and the poor. The middle classes tend to accommodate their home-based work through under-occupation. They have a spare bedroom, they have a garage that they don't use much, they have room for a shed in the garden, or they can build an extension. Whereas people in social housing or young people in shared housing simply don't have that luxury and have been really, really suffering and struggling as a result. And the third has been the Suburban Task Force. And of course, what's happening in the suburbs is absolutely fascinating. So what's happening in the central business districts and the suburbs, and the transformation that's happening to both areas, is something that I've been writing about quite a lot. I am being invited to speak a lot. So this week, I think there are 4 events, including the European Commission and the Northern Ireland Federation of Housing Associations. And in a way, what I'm finding really interesting is that people are really, really keen to find out more about this field in all sorts of different areas. So the fact that housing associations are thinking about how they can help their social tenants to work from home is a really big one for me, because I think the stats show that in May last year, when more than 50% of middle class people were safely working at home full time away from the virus, only 1 in 5 working class people were. And so COVID has thrown up some really major, just cast light on, didn't create them, they were already there, social and spatial inequalities. And then new research. So I've been involved in a couple of surveys. I've put in 2 bids, both relatively small, but one successful. I'm working on space standards. So this is the whole idea that current space standards that all new housing is built to don't take any account of the need to work from home. And then I've got a couple more research bids that I'm developing. One is about principles, standards, and a toolkit for designing for home-based work. And one is about bringing home-based work in social housing out of the shadows, because not only do people, social tenants, not have enough space, but very often they have tenancy agreements that actually either prevent or prohibit them from working from home in their social housing. What else is there to say?
That is incredibly comprehensive.
That'll do.
No, thank you. And I mean, again, just a huge amount that I think we can draw out from that. And something that's quite striking already from the 3 of you who've spoken is the way that you do sometimes have to be prepared to play a bit of a long game here, that some of the research that you might have been doing for years and years is suddenly something that's topical, and we can talk about a little bit about that in a bit. Just a reminder, do keep sending your questions in for our panelists, and we will start to turn to those very soon. But of course, while we've all been shut up in our homes and trying to childmind and do our work and everything else, and there are lots of things we've not been able to do during the pandemic, key among which is kind of cultural activities like going to the theatre or watching live music. So Adam, over to you to talk a bit about that.
Thanks very much, and thanks very much for having me, and also to everyone else for really interesting contributions. a lot of which resonates with what I'm about to say, actually. So my research area is popular music, the sociology of music, and the music industries, with a particular focus on live music. And this point about the long game and our previous research coming into play is significant here. So some of my prior research projects have been looking at, there was an AHRC funded investigation of the cultural value, and we looked at the cultural value of live music, you know, against and in line with its economic value, and also the local ecologies of music, conceiving of a local area as on an ecological model, the relationships between different types of venues and different types of practitioners and non-musical actors as well, which of course includes policymakers. So that might be local councils in a city, or, you know, scaled up DCMS, for instance. As part of that, in 2017, we did a UK live music census, which involved sort of volunteers going out into all venues in their city on a census night and marrying that up with surveys and qualitative work. So that kind of wholesale model of how live music fits into its local area has become salient now. Obviously, live music has been hugely impacted by COVID-19 and our own research as well. So I had my research has been affected in different ways. There was a project with colleagues in Birmingham looking at, which was going to apply that census model to Birmingham as a case study. We didn't do an in-depth investigation of Birmingham as one of our case study cities the last time. And that was looking at music in a post-2019 environment, the original emphasis of which was Brexit. But that model of sending volunteers out and going into dozens of venues overnight and going between them to head count and look at how many musicians are playing and how many people are in the audience on a census night, even if the venues had been operating, that would have been tricky. Clearly, that model in the context of the pandemic, it's difficult to conceive of anything that's as diametrically opposed to healthy practice in the middle of a pandemic. So we had to really turn that project on a dime and re-emphasize it towards more qualitative work and interviews, engagement with venue operators, but also the organizations that are working to support the live music sector. And so previously we've been working with UK Music, Musicians Union, Music Venue Trust, and all of these organizations are involved in something called Next Start, which is, I will just remind myself, a national exit strategy advice and response team for hospitality and entertainment. So these are these new kinds of support agencies that are evolving. And I think that's key to my research, has always been, but is particularly now, engaging with government, but also at the same time with industry and with those other bodies that also engage with government, like a two-pronged approach. The other response was new applications. So with a colleague at Newcastle, the British Academy did a small grant scheme in response to COVID. So my colleague at Newcastle, Larry Zadzo, is a countertenor. So we are looking at the experience of classical singers whose careers have been put on hold as much as venues through COVID. Again, that's qualitative work. And we've also put into the UKRI, the AHRC COVID Agile Response Scheme, which again is with those industry bodies as partners, because they're doing research as well. And so that, you know, the research that we do can be useful to them and their findings useful to us. So those sort of multi-strands alongside the alongside direct engagement with government. And likewise, it's about sort of maintaining relationships. So I've been attending for a while now the Scottish Parliament cross-party group on music. So yes, there's submissions to inquiries, but there's also that sort of once every 3 months, just being in a room or a Zoom, as it turns out, to have those conversations. And as Rebecca and Sabrina mentioned, writing for academic journals, but also the likes of The Conversation. I've been writing occasionally for the New European, just to get an audience that might not automatically turn to academic journals, or indeed have access to academic journals. So that's about where we are at the moment. We've got the British Academy grant on the go. We're finishing up now the Birmingham project, which was funded by the AHRC's Policy and Evidence Centre, run by Nesta, and we're waiting to hear about the COVID application. So a lot of common ground, I think. I think that's it for now, unless look forward to questions.
Great, thank you all so much for those initial thoughts, and we've got lots and lots of questions flooding in, which is always good to see. Thank you to everybody watching. So just to pick up on a few of those things, a question that has been asked by John Charlesworth in the chat. So he's pointing out that, of course, arts and humanities covers a huge spectrum of activities. But also, you know, he's asking, and this is not the easiest question perhaps to answer, but what do each of you see as perhaps the main priorities in responding to COVID in the next 10 years? And if I perhaps just add to John's question, you know, what do you think are going to be the top 2 or 3 issues that policymakers are going to be most engaged with? Rebecca, shall I perhaps start with you?
Sure. I don't know how to make the answer any smaller than responding to COVID, and so trying to get to a point where we can have something approximating normal life again, with perhaps keeping some of the changes that people have thought have been very positive. So perhaps more home working is the norm, those kinds of things, more active travel and less commuting in general. But trying to return to something that allows us to socialize and live our lives in the ways that we'd wish, without risking the health of the most vulnerable in society in particular. So as far as I can tell, you know, just trying to work out how we can keep infection levels low, prevent any significant further waves of infection, particularly really scary waves that, you know, could risk the effectiveness of vaccines and those kinds of things, and kind of learning from it from the future. I mean, this is undoubtedly not the last pandemic that that people are going to experience, so kind of learning lessons from this one to make sure that future ones are dealt with better, I hope. I mean, some of the responses have been less than we should expect, I think, and we can learn from that and do better next time, I think. So that doesn't sound very helpful, but I don't know how to I don't have one neat thing that I think is the most important, or even the top 3, I suppose.
No, that's a very fair point, and yes, sometimes we cannot give simple and straightforward answers to questions.
Yeah, sorry, I'm a philosopher, so I'm a disaster particularly.
Francis, what about you? What do you think are kind of the key issues facing policymakers in the next decade?
From my perspective, from the perspective of the built environment, this is a paradigm shift. And for more than 100 years, we've been systematically separating dwelling from workplace. And what we have to do now is find ways to reintegrate these two things. And this is enormously problematic, because it's not just our buildings that have been designed as monofunctional entities, but all our governance systems are in silos. So it's housing or it's business. And we're going to have to do some really, really interesting reworking, unpicking of systems like our planning system, our property taxation system, our tenancy agreements, all sorts of insurance, mortgages, all sorts of areas, fields of policy that are going to need to be unwrapped to see where the issues lie and then unpicked and reworked. And I think this work is happening already. There are really, really big movements to start to think how can we redesign our built environment to meet this new challenge.
Adam, what about from your perspective?
I think, well, broadly, two things. One is, I don't know about the next 10 years, but in terms of culture, I think what the policymakers could do perhaps more than they have done recently, understandably, given that the situation has been moving so fast, is to think a little bit more strategically and a little bit less tactically. It's not just a question of, well, how do we get the venues to reopen safely, for instance. I mean, the venues are doing themselves a lot of work on that. It's thinking that actually 3-4 years down the line, once they open, that's not it. I mean, for a start, things like festivals are planned 2 years ahead. Musicians will have lost their PRS revenues, their performance revenues for the last 2 years, at least for the next 2 years, sorry, from not having operated recently. And then I think there's going to be, as part of that, I think a sort of very careful unspooling of all the changes that have been made over the last year, so that culture recovery fund has been the single biggest injection of cash into the cultural sector, admittedly just to keep it afloat, such as, you know, in generations. And it's how to unspool that without just pulling the rug away. You know, the size of the state now compared to 2 years ago is enormous, and it's and certainly that applies to culture. How do we, if we do, you know, how do we tack away from that or forward without just knocking down the bottom cards on the house of cards? How do we maintain that level of support in a financially sustainable way, but without just sort of switching off life support for venues that say, okay, well, you're open now, that's that. So that's maybe not 10 years, but that is a good 5 years worth of thinking ahead that needs to be done. And for the next 5 years, it's just sort of managing in not maybe quite the same way as housing, but, you know, live performance has gone online. There's all these new business models that are emerging. How do we sort of manage those, many of which involve data and shifting data in a sustainable way, so that grassroots practitioners can also benefit from them, and it's not just the such and such a city symphony orchestra or such and such a major label artist.
And Sabrina, what about you?
I guess my answer can be a little bit more straightforward, because it's at the core of what's in the media and really on the mind of the government. I believe at the moment we have to address social structural inequalities that have been brought into sharper focus by the pandemic. I think it's pretty obvious when we're looking at the impact of the virus on the BAME community, for example. I think minorities have been greatly affected for a number of reasons that range from nutrition to housing to really socioeconomic factors that need to be addressed. That should be #1 priority, hopefully, for any government in power. And that goes hand in hand as well with the work that the government is looking at right now with their new white paper on reforming, again, the NHS. And this is an interesting proposal that hopefully gives a lot of power to the Minister of Health. Interestingly enough, and it would be interesting to understand why that was the particular choice made by the government to structure in that way. But to a second aspect of that white paper is really greater integration at the local level. And we've seen local authorities throughout lockdown 1, for example, calling for more integration to be able to implement things better. And also the role of clinician in healthcare law and policy, as we've seen kind of a little bit of a disconnect at the beginning of the pandemic. In the first few weeks, we see guidance from Royal Colleges, the BMA, but no national guidance that's been officially published, although there were drafts circulated. So it's interesting to see the dynamic there of rulemaking and allocating resources that are very scarce. This is something that has always been going on in healthcare. Of course, we know the NHS is strained, but I think it's been brought to the attention of the public when you start thinking about numbers of ventilators and whether or not you're going to allow a certain category of people of having access to them or intensive care units. You see these debates are really brought into a different light, and that's something that is just underlying in the healthcare system, but now it's been brought into more dramatic terms. So I think that this is something definitely that will need to be addressed as well.
I suppose picking up then on that point about the scale of decisions that are having to be made by the government at the moment and in the midst of this pandemic. We've got a couple of questions from John Mason and Anne Burrell, which I think kind of both get a similar issue, which is, I suppose, how you can bring the public in to a lot of these debates that are, of course, about public health. They're about people's personal circumstances, people's individual freedoms, and so on. But we're seeing a lot of these discussions, made at government level out of necessity. Is there a way, do you think, that researchers can help perhaps bridge a bit of that gap between policymakers and the public? And do you think it's helpful to try and engage the public in these debates? How might researchers go about doing that?
I'm happy to speak a little bit about this with regards to the research that I conduct on guidance drafting. Of course, the circumstances under COVID-19 are very different than usual guidance drafting, because typically you see a process, for example, with NICE that is in sequences that are longer in time. So issuing guidance can take months and years. Here we had to see guidance being done and published within weeks, obviously to answer the needs of frontline workers, but there's always patient involvement. Bioethicists are involved and patients are involved. And I think there's a movement in general with healthcare innovation, for example, of patient involvement, because their experience matter. So looking at the different factors, and that's what we are looking at with our project, is looking at different factors that have impacted the guidance drafting in this very unusual time, needs to take into account what was the place of the patient experience there, and how later on looking at how patients have reacted to their experience during the pandemic. And of course, the patient experience has been greatly impacted on other aspects of healthcare, cancer care, for example, or any other aspect of the NHS, really, because of the suspension of certain interventions. I think with regards to structural inequalities, in our research, we call for the government to involve ethnic minority groups into the development of this new NHS or this reformed NHS, because it doesn't adequately answer their needs, because they might not be as involved as they should be in designing the system, and for the system to answer their needs, and not the other way around of them trying to fit themselves into a system that doesn't really mirror their reality.
Mm. Adam, had you wanted to come in as well?
Yeah, it's a slightly more general point than that, but I think that one thing that arts and humanities researchers generally are quite good at doing is constructing narratives, taking data points and people's experience, and academics in general are able to take a longer view and to formulate those experiences of people on the ground and shape a narrative around it that's perhaps easier for policymakers to grasp in an output or a series of outputs than in the many voices that they will hear every day. The academics can sort of corral those voices and construct them into a narrative, and also, as before, take that longitudinal view. I mean, as you know, Francis's work was demonstrating that sort of how has housing changed over 100 years, or how have experiences of live music changed over 30 years? What's the experience of the festival circuit over 40 years? That those kinds of stories can be condensed by academics and policymakers, because that's what we do as part of our day-to-day work.
Francis, Rebecca, is there anything that you'd like to add to that?
I think I'd agree with Adam there that the narrative has a very strong role, and I think that I've been writing a bit in the Guardian, in other places like that, and I think stepping out of the academic environment is actually really helpful in terms of the built environment. So I've been involved in 2 architectural competitions because suddenly this is an absolutely hot topic, and I think then the minute these ideas get out into practice, and then you start to get engagement with the general public. Although with home-based work it's a particular problem, because I think for years people have tended to work covertly because they either fear they're breaking some regulation or other, or they actually are breaking some regulation or other. So it's a very interesting moment in time, because suddenly, you know, I mean, everyone on this call is in their own home, and that from my perspective is incredibly interesting, and suddenly we're all able to be much more open about it.
Just on that point, actually, Rebecca, I was going to come to you because just thinking about what's been said about, you know, how academics and researchers can help to construct narratives and the role that can play. Something you mentioned earlier was how in a lot of the media work you've done, you've had to be quite careful to kind of guard against your research being presented as representative of certain positions, and you've had to kind of work to separate, you know, what your research is saying from what your own personal position might be. How do you think researchers can guard against that or avoid being put in that kind of position?
So a colleague of mine, we had a discussion in my centre quite recently about doing media work and interviews and those kinds of things. And a colleague of mine who does a lot, he said that he thinks to himself as he's presenting the argument for a particular position, and it's not him. Okay, so what's being evaluated by the media or the public is this argument and this position, and it doesn't need to reflect upon himself in any way. So some of the topics that we work on can be quite controversial. So I work on immunity passports. I've had a few emails from people who are very upset about the idea of them and have called me all sorts of things. But colleagues of mine work on things that are much more controversial than that, things to do with abortion, things to do with mandatory vaccination, these kinds of questions. And I really admire the way that they've managed to kind of separate themselves from the arguments to some extent, and to guard against the kinds of destructive effects of people being quite upset and quite aggressive when it comes to those things. So I think one thing to do is just to try and dissociate yourself from it to some extent, and hopefully that allows, I mean, my aim is to, as I mentioned before, to try and maintain kind of intellectual honesty, and not to allow my own ego and desire to win an argument or for people to like me to get in the way. And that's obviously that's I'm only human, and I both want to win arguments and for people to like me. So I struggle with this sometimes. But I think that's really important, and I constantly try and go back to this question, and be it immunity passports or whatever I'm thinking about or talking about, to think, okay, do I really do I really believe this? You know, am I just like playing a philosophical game here and trying to construct the strongest argument possible for this position, whatever it may be, or do I actually do I kind of back myself to that this is the right position to hold? And I try and do that. I think it's hard. It's very easy to get wrapped up in much more kind of human tendencies, as I was mentioning. But that's my attempt. I'm sorry, Alice, I've actually forgotten the question you initially asked when I don't know if I've answered it now.
You have answered it.
Some other question.
No, that's absolutely fine. And I suppose if we just continue with the media aspect of this for a moment, it was quite striking in what several of you said at the beginning, which is how actually quite soon after the pandemic hit, you found that you were getting a lot of media coming to you rather than you having to go to them. So I suppose there's a broader question there about how, from what a lot of you have said, practically research has perhaps been more difficult to do over the last year, but actually has impact work, or perhaps aspects of impact work, been a little bit easier if you've got the media approaching you, if you're not having to go into television studios, but you can do things for your home? Is that something that's perhaps felt easier? And are there any lessons, I suppose, that we might take for that about future impact work? Sabrina, do you want to kick us off?
I have to say that my experience was extremely limited before, if not in existence. So I wouldn't be able to tell you if it's easier to be in a studio. What's really easy, however, is when you get a message on your phone, you get a WhatsApp message from a journalist that says you're on in 10 minutes. It's easy to just jump to the other room, put something on, and then look half presentable, at least from the top. So that's really convenient. What's less convenient is the children aspect. We touched upon that. It's challenging at times to make little ones understand that mommy cannot just open the door. And I think that speaks to a very big reality of also of carers and predominantly female academics that had to mediate the context of research and impact work with their family life. There's a lot of chat about it, I'm sure, in all departments. I've had those discussions with my colleagues, how we've had to we were always academics and mothers, but now we have to kind of combine both. And at times I felt like some people wanted to apologize for being mothers, and then all of a sudden we saw a shift as well in the media and all these funny bits of interviews where we see children come in and the different reaction of parents. They're extremely patient. In my opinion, I admire those women being so patient with the child coming in. But I think that's a very important aspect that should be kind of brought forward. We're researchers, but we're also very much humans. So yeah, the impact work for me has been much easier, just because I became all of a sudden more interesting in my research, because I work on rationing. So utilitarianism or egalitarianism were things that were shown in the media, which I had seen not so frequently before. So it was easier in that aspect, yes, I guess.
Frances, what's your experience been like? Because you mentioned that you've been holding a huge number of events just this week alone. You've been invited to speak a lot. Have you found that impact work is perhaps a bit easier?
My experience has been completely extraordinary. It's been accelerating as the pandemic has progressed. And I think the lesson that I've learned is that research really only maybe really impacts when it's necessary. And suddenly, when it's relevant, suddenly the impact, you know, I used to wonder how to, in fact, at the beginning of COVID, I wondered how I was going to get my research to impact on the situation. And now I simply don't worry about that, because the invitations plop into the inbox, and, you know, people find me from all over the world and are interested. I suppose because I've been doing it for 20 years, I've been sort of slogging at this slightly eccentric corner of architectural research that suddenly has enormous relevance. So I suppose, yeah, from my perspective, impact has been really easy during COVID. And in a way, I feel as if I'm preparing the ground for some quite big I think that for me, the jury's out as to whether research is more difficult under COVID, because I think that my experience with Zoom is very good. And so I have a feeling that I might well be able to do good interviews, make good case studies with people, you know, even without meeting them in person.
I'm conscious that time is rapidly running out. So one final question to each of you, which is, drawing on your experience over the last year, all of the things that we've spoken about, if you were able to give one piece of advice to colleagues in the arts and humanities about how they can best create impact with their work, how they can influence some of the major policy issues and challenges over, you know, the next year, the next 5 years, next 10 years, what do you think that one piece of advice would be? Adam, let's start with you.
Going back to what we said before, I think play the long game. Keep doing what you're doing. Have the confidence in the value of your work. There's not going to be sort of pivoting to something completely different. Think, I need impact, I'm going to go and look at this. Will make your research even more difficult. There are all the sorts of immediate things you can do, write articles for newspapers, reach out to APPGs or inquiries, but just look at the work that you've already done and are already doing, and try and filter that through the impact lens, rather than try and think, how can I do research that will have impact? You are already doing research that can have impact. The question is, you know, the channels through which you distribute it.
There's a message of hope for everybody in there. Rebecca, what would be your one top tip?
Well, that's so interesting. So I was thinking exactly the opposite of Adam, and I don't know whether so what I did was I was, at the time the pandemic hit, I was working on responsibility, kind of technical philosophical arguments around responsibility for habitual behaviour. Seemed completely irrelevant for the COVID-19 pandemic, and I just took on this new topic, which was immunity passports. Now I have a background in bioethics, so like I'm reasonably well positioned to think about, okay, what are the kinds of arguments that are relevant here? What are the ethical issues around immunity passports? So to some extent, I guess there's a long game there. Like all of my training and all of my experience was relevant and useful, but essentially this was a new topic for me. So I was thinking the best way to have impact is to think of something that's important that you can contribute to, and to crack on and do some work on it. But then that's the way I quite like working. So I quite like, you know, maybe shorter projects, getting to grips with a new topic. I'm not necessarily a typical philosopher in that my strengths perhaps don't lie in like spending 10 years working on whether this semicolon should be in that position, or, you know. So yeah, but you know, take it or leave it. Adam is probably right. I'm probably wrong on this, but
I think they're opposite sides of the same coin, though. Actually, I think we were just talking about slightly different ways of expressing a similar thing. Like your topic might be new, but you talk about that hinterland of.
Yeah, I think
that's
you're
nice.
right.
Yeah, we agree.
Frances, your top tip.
My top tip always is to find something that you're passionate about, that you find really, really, really interesting. Because I think casting around for a subject that's going to make impact, that's going to make your name as a researcher is a hopeless. It's not a good path. So I always say to people who want to do a PhD, don't do a PhD because you want a PhD. Only do a PhD if you've found something that you have to research. And I think it's the same. And I think any situation can throw up things that in some ways trigger us to go, oh my Lord, look at that. I've got to find out about that. I need to do some work on that. That would be mine, is follow your interest ferociously.
And Sabrina, last but very much not least, what would you say?
I very much echo what Frances is saying, but I would also speak to not being fearful of putting an idea out there. I remember when I started my research on healthcare reforms, people thought, oh, this is not really law, it's not really philosophy. It's neither, quite frankly, but now it's interesting. So I think the bottom line is to stick to what we know and what resonate with us as researchers, but also as individuals, because it's about connection. It's about connecting through ideas to research. Helping people really is what we're all here for, I imagine. So I think it's about just putting yourself out there in the sense that stick to what you know, stick to what you're good at, but also have the confidence that if it's a little bit outside of the box, it might be a very good idea, actually.
Thank you so much for that. I'm afraid we will now have to draw this event to a close. Audio and visual of this event will be available on the IFG's website in the next 24 hours if there's anything you'd like to watch back. And really, I'd just like to finish with 3 big thank yous. The first is to all of you for watching and for submitting all of your questions. I apologise that we were not able to get to all of them. I'd also like to thank the AHRC for its support. We're delighted to be partnering with the AHRC for another event next Monday, that's the 22nd of March, looking at how governments can combat misinformation. We've got a great panel lined up for that. Please do join us, and you can find full details on our website. And finally, please do join me in saying a huge thank you to Sabrina, Rebecca, Adam and Francis for their time this afternoon and for their valuable insights. Thank you so much for being with us.